This is the Chapter 12 Female Reproductive System. The female reproductive system consists of internal and external organs, the internal organs being the ovaries, fallopian tubes, uterus, and vagina. The external organs being the labia majora, labia minora, the clitoris, and Bartholin's glands. The ovaries are the almond-shaped glands which produce the ovum, which is also known as the egg, and various hormones like progesterone, estrogen, and testosterone. The fallopian tubes then extend laterally from the uterus. So the fallopian tubes are these. They extend laterally, which means to the side. And here is the ovary, those almond-shaped glands that we just talked about. The fimbriae then create wave-like currents to pull the ovum into the uterine tube. The fimbriae are on the end of the fallopian tubes right about in here. And your book has some better illustrations than what I have here. The uterus then is a hollow pear-shaped structure consisting of 3 parts located between the bladder and the rectum. There's a good diagram on page 388 in your textbook of the different female structures. The vagina then is the muscular tube extending from the cervix to the exterior of the body. Menarche is the term that's used for initial menstrual period occurring at puberty for girls at about 12 years of age. And so this is when a female begins her menstrual cycle. Pregnancy, gestation for a human being lasts approximately 9 months, and the medical term for giving birth is parturition. Labor and childbirth, or labor and delivery. There's a good picture in your book on page 392 that shows the stages of labor, and the first stage is dilation, which is when the uterine contractions begin with dilation of the cervix to 10 centimeters. And so that's where a lot of females spend a lot of their time of labor, is the dilation phase, because sometimes they don't progress very quickly to that full dilation. Sometimes they'll get stuck in that phase where they will need some medication to progress the stage of labor. Then comes the expulsion, which is the stage from dilation to the actual birth of the baby. And then the placental delivery is the last stage, where the uterine contractions discharge the placenta, or the sac that has been around the baby during the time that it was developing. Oh, and then I put in here first stage, the second stage, and then the third stage. Menopause is the cessation of ovarian activity and diminished hormone production that occurs about age 50 in females. So symptom-wise, this is when females stop having their periods, and so the medical term for that is amenorrhea. Rhea means discharge or flow, a means it's without, and meno means menses. They can have hot flashes and vaginal drying, some emotional instability as far as the hormones no longer being there, so they have some emotional lability. Treatment for menopause is estrogen replacement therapy, ERT or HRT, hormone replacement therapy. Now, the hormone replacement therapy is controversial because studies have shown that hormone therapy over an extended period of time has been clinically proven to potentially cause breast cancer in individuals, and we have to look at that very closely to determine if that is going to be beneficial for the patient. So, like, let's say someone has a history of breast cancer in their family. We don't want to put them on hormone replacement therapy because that's just too risky. So the hormone replacement therapy has good benefits in that it stops some of the the symptoms that a female has as far as the hot flashes of the vaginal drying, but it also has another good quality, which is it helps in the prevention of osteoporosis and heart disease. Pathology that we see of the female reproductive system: menstrual disorders, dysmenorrhea. If you can break this down, rhea means discharge or flow, dys means difficult or painful, and meno means menses. So any difficult menstrual cycle. Metrorrhagia then is an irregular uterine bleeding between menstrual periods, which indicates a disease that may be benign or malignant. So the only time that this would be a problem that shouldn't be investigated, or probably should still be investigated, but some females that are on Depo-Provera for birth control will have breakthrough bleeding between cycles, but it's not a typical finding, or it's not a normal finding for someone who's not on that medication. Menorrhagia or hypermenorrhea, hyper being the key there, is profuse or prolonged bleeding during a regular cycle. So if a female is going through more than like 1 pad per hour, that is considered a prolonged bleeding, or profuse, I should say. Premenstrual syndrome, PMS, occurs several days before the onset of menstruation. Females will start to have this because the hormones fluctuate during that time, and as the hormones are at their highest level, then symptoms can come along with those, including irritability, emotional tension, anxiety, mood changes, depression, headaches, breast tenderness, and water retention. And then depending on the female, there can be other things that develop as well. They'll have an increase in acne. They may have an increase in the oil production on their face. There's a myriad of different cramping, different all kinds of symptoms that a patient can have, but these are the biggest ones that we see. Endometriosis is a condition where the uterus basically continues to grow outside of the uterus. And there is a good picture in your textbook of endometriosis on page 400, and it shows all the places where uterine tissue can continue to grow outside of the uterus, so it can become very problematic. So this uterine tissue then can grow in different areas of the abdominal pelvic region and can cause patients quite a bit of problems. It can cause pain, and it is one of the leading causes of infertility because many times the uterine tissue will obstruct, like the ovaries, or grow around the ovaries and make it difficult for conception to occur. Pelvic infections, or PID, is a general term to mean inflammation of basically all of the internal and female parts, the uterus, fallopian tubes, ovaries, pelvic structures, caused by a bacterial infection. Some of these, if left untreated, can cause infertility. Septicemia, which, if you remember, is a systemic infection where the microorganisms have invaded the blood supply. It could cause PE, which is a pulmonary embolism, which is a blood clot to the lung, or shock. A vaginal infection is the most it's common in females. Vaginitis is inflammation of the vagina due to infection. Symptoms for the female: painful intercourse, genital itching is probably the number one, genital itching, and foul-smelling vaginal discharge, or like a cottage cheese type discharge from the vaginal canal. And this is considered candidiasis, which is the name is given because of the organism, the yeast organism, Candida albicans. And this is just basically a fancy name for a yeast infection. So many times we'll see females that will get a yeast infection after taking an antibiotic, because antibiotics are known to get rid of the normal flora or the normal bacteria that's present in the vagina. And when it does that, it allows any yeast that's there to kind of take over. So treatment of that is antifungal agents. There's over-the-counter medications, suppositories that can be used, but there's also prescription medication. And within the last probably 10-15 years, they came up with a drug called diflucan, which is a pill form that you just take, and then that will eradicate the yeast infection. So that's a little bit more user-friendly than suppositories and creams and all that kind of stuff to the vaginal area. Trichomoniasis is a protozoan infection known to be one of the most common causes of sexually transmitted disease. It causes vaginitis or inflammation of the vagina, inflammation of the urethra, and the bladder. Cysto, if you'll remember, means bladder. Oncology that we see of the female reproductive system. Breast cancer. It's the most common malignancy of women in the United States. Mammography is done to detect breast cancer, and so that is an x-ray of the breast done routinely after age 40. So basically, you see here in this picture, the breast is put in between, or it's on this plate, and then this plastic plate comes down and it basically compresses the breast, and then an x-ray is performed, and then we get an x-ray image that looks as such. So the radiologist then will look at that to determine if there's any suspicious areas in the breast tissue. If a female has a history of breast cancer in her family, they should begin mammography earlier than age 40. My mom had breast cancer, and so I began mammograms at age 25 and have had a mammogram every year since then. She had bilateral breast cancer, which is unusual. Usually a female will have it in one breast, and then they potentially do a mastectomy, but this was in the early 80s when they weren't as aggressive doing mastectomies at that time. And here's just another picture of a mammogram and how they compress the breast tissue. And then here's an x-ray of a lesion that's found on a mammogram, or it's a tumor. Cervical cancer then most often affects women ages 40 to 49, and in those with a large number of sexual partners, a previous STD infection, and sexual intercourse at a young age. So when females go in for their yearly exam, sometimes they will ask questions like, how many sexual partners have you had? Have you had a STD infection in the past? And how old were you when you began having sex? And that's to determine the risk factors for potential cervical cancer patient. And so if a person had multiple sexual partners, previous STD infection, and began intercourse at a young age, and they came back with an abnormal pap smear, then we would be more aggressive at going ahead and doing maybe a biopsy or a colposcopy in order to determine if there was some malignant cells present. So the reason, or the test that we do to check for cervical cancer, is called a Papa-Nicolau test, or a PAP test. And it got the abbreviated name PAP because most people can't say Papa-Nicolau, but how did it get that name? It was named after the man who invented the test, George Papa-Nicolau. So basically what the test is a cytologic exam that can detect the cervical cancer before it becomes clinically evident. So they take a speculum and place it into the vaginal area, and then the physician takes a cytology brush and scrapes away some of the cervical cells, and then they put it in a jar of formalin, and then it's sent to the lab for a pathologist to look at those cells. And they show a picture of this in your book on page 410. PAP tests should be done once a girl becomes sexually active and continued yearly. Medicare has some different guidelines as to once a female is in Medicare age, that they say if you have a normal one that you can go every 3 years, but I am a firm believer in yearly pap smears because if caught in its earliest stages, cervical cancer is treatable. So if you let it go and it continues to grow for 3 years before you find it, then obviously your chances of survival or of eradicating it are not as great. Diseases and conditions you need to know for the quiz on page 401. Dyspareunia is the first one, which is just a fancy name for pain during sexual intercourse. Uterine fibroids are benign tumors composed of muscle and fibrous tissue that develop in the uterus. Eclampsia, you probably might have heard of, is a serious form of toxemia during pregnancy, where the female has high blood pressure, swelling of the lower extremities. They can have protein in their urine, and it can become rather problematic. Usually they put a patient on bed rest when eclampsia sets in. An ectopic pregnancy is fairly common, and they show a good picture of this on page 402. And that is when the fertilized ovum does not implant inside of the uterine cavity, but it implants in another area. So they show all the different places where it can implant. It could be in the abdominal area, in the fallopian tube, in the wall of the uterus, all different types of places. But obviously if the fertilized egg is not within the uterus, the baby is not going to be viable, or the pregnancy is not going to be viable. Medical, surgical, and diagnostic procedures to know for the quiz. Page 403, dilatation and curettage. Actually, that's not on 403, that's on 404. It's abbreviated D&C, and so this is a procedure where they basically kind of clean out the inside of the uterus. So if someone has had a miscarriage, they will do a D&C to scrape out any of the fetal remains. Females may have this procedure done if they have dysfunctional uterine bleeding. That will kind of clean out the inside of the uterus so that they don't have bleeding when they shouldn't have. A hysterectomy is excision of the uterus. There's different types. You don't need to know that. Just know that a hysterectomy is removal of the uterus. Laparoscopy is visual examination of the abdominal cavity, and they show a picture of that on page 406. And so this is a kind of what we call a belly button surgery. And so they make one incision into the belly button area and then one over to the side, and they use these long trocars from the outside of the body to do a visual examination of the abdomen. And they can do surgeries this way as well. They can remove gallbladders. They can do lots of different surgeries this way instead of making a traditional incision on the abdomen of a patient. Mastectomy is excision of the entire breast. Tubal ligation is a fancy name for female sterilization. So they tie they ligate, which means to burn the fallopian tubes to prevent pregnancy. Amniocentesis is a procedure done to determine if there's some type of fetal abnormality in the baby before it's born. And so they take a very long needle and they puncture through the abdomen of the female, and they withdraw some of the fluid from the amniotic sac and send that for a pathologist to look at. Papinicola test we talked about. That is on page 410. And then mammography, we also talk about that, which is an X-ray examination of the breast to screen for breast cancer. Abbreviations you need to know on page 413. D&C for dilatation and curettage. GYN, which means gynecology, or the study of female reproductive tract. LMP, which means last menstrual period. OCPs, oral contraceptive pills. STD, sexually transmitted disease, and OB, obstetrics. You are responsible for memorizing all of the word elements and their meanings from pages 395 through 398, all of the combining forms, prefixes, and suffixes, and their meanings. Here ends the recording for Chapter 12, Female Reproductive System.